Ready? Okay. So, we've had some information. Everybody understands it. They're all comfortable with it, right?
Sure. Yes, we all understand it fully.
What are the other 1,199 pages about? You kind of surmised, you told us what's going on. How come the document is so big?
Well, because that's a fair question. The act itself, it's actually two separate statutes, but it was very thick because there's a lot of detail. You actually have three separate laws that are impacted. You have the Internal Revenue Code for some things. You have ERISA, which formally stands for the Employee Retirement Income and Security Act of 1974, but is often referred to as every regulation is somewhat ambiguous. And then you also have the Public Health Act that is being modified. One of the things that, one of the big changes that gets in that technical stuff is that if you have a plan under the tax code, like for health care, if there was a problem, if you had this, like if you violated these non-discrimination rules, the worst that could happen is that the employer would lose the ability to deduct the cost of the health insurance. So it would just affect the tax return. It wouldn't affect anything else. Now it's a violation of ERISA and the public health codes. So now there's greater exposure because the individual employees can bring a lawsuit against the employer, and the government, the Department of Labor, as well as the Internal Revenue Service, can come in and take action against the employer for violating the law. So there's more private right of action. There's greater exposure, at least with that. Aside from the Medicare Part D on the prescription drug coverage, Part C deals with Medicare Advantage programs, and that over time will be phased out. And there's language in there dealing with that program, a reduction of the dollars going to support those type of services. There's a whole lot of language talking about these exchanges that are to be created for the states and how they go about doing that. There are issues relating to hospitals and hospital care. There's some things that are relevant, industry specific that I didn't touch upon. But for health insurance companies, there will be limitations on the type of compensation and benefits that can be provided, getting into loss ratios. So there's a whole lot more detail that is indirectly relevant to the general public and more directly relevant to targeted groups and populations. I didn't talk about that, especially when I only had about 20 minutes, 25 minutes to try and communicate the general stuff.
Well, you seem to have a pretty good handle on it going through all these. In your personal opinion, do you feel that it's viable to make this big of a change with, there's so many things going on all at the same time?
Let me say, I certainly have my concerns. And
I just think it's something, like I said, you explained a good portion of it, and you know a heck of a lot more about it than I ever will, but it just seems kind of insane almost that the document is so big and complicated. I can't, you think they can condense it, that an average guy can have a snowball's chance and where of understanding?
Understanding it, yeah, through having content, through programs like this, and having the opportunity to hear presentations about it. Certainly this is not the be-all, end-all. I tried to cover it all, but it's also, as it's a responsibility of us to take care of our own health, it's also a responsibility to get to know it. So I'd say to the extent that you hear about other programs, educational programs, forums that talk about it, you should definitely go, because now you've got a good chunk. You can probably add a little more and improve yourself. And succeeding in business, that's part of what it's all about, is trying to be informed and listening to others and take away from that.
Thank you.
Sure.
Yeah, so basically two questions. One is, if
sounds like it's gonna go to the Supreme Court. Would the implementation be put on hold while it's being reviewed by the Supreme Court? And the second question is, there's this whole issue that there's the other issue that, let's say, if the attempts to stop implementing it didn't really happen, wouldn't have perfectly approved the resting perhaps, but it's not funded. How do you deal as an individual and as a business with these two what-ifs may happen? How do you plan as an individual, how do you plan as a business? What might be the impact?
Okay, well, the answer to the first question is pretty short and simple. Is that the decision was made, it was held unconstitutional, but the judge said that while an appeal could go forward, even though his ruling was he found it unconstitutional, that he wasn't going to stop or undo anything, in part because the requirement doesn't kick in for a period of time. So while we have to do some planning, right now, it's held unconstitutional. The law or enforcement or further steps have not been stopped in any way. There's no order that the government must stop the process at all. So yes, it's going to continue. There's no stop in place. As with respect to how do you advise, how do you deal with, how do businesses and individuals deal with all this? My partners in crime here, you guys provide advice all the time about things that can be done and and how do we plan? What do you tell your clients about planning?
Don't hire that next employee.
Oh, come on, don't be a Debbie Downer there.
Listen, or if you're going to hire them, make sure you comply with the law. That's compliance, and that's something that you need to watch in this arena is your employer's girl. Oh, you want me to talk out here? Thank you, Mark. Mark wants me to talk to you folks.
All right.
All right. What you need to do is you need to basically look at the growth of your company, and if you're bringing on more employees, you have to be aware what the laws are, how they're going to affect you when you hire them as employees, like adding another plant. You've got to deal with, can you justify adding the plant and earning enough profit to pay for it? The same thing when you add the next group of employees with the health insurance.
On a personal point, I think most of us are familiar with the HSA concept where you're deducting pre-tax dollars, putting them into an account that can be used for qualifying expenses. Even if those expenses are changing, there's still going to be doctor visits, dental visits, all the types of things where you need that money. What most people don't know is that you can actually, depending on who holds your HSA, if you hit a balance of $1,500 or more, or $2,000, depending on who you're with, you can actually invest that balance, and the money would grow tax deferred, and it will actually be distributed tax free as long as you do that with a qualified expense. I know it's a plan by plan, but that's something where if it's not being tapped into, that might be a great way to build money up while the uncertainty is still here, and maybe you're not as concerned if there's $5,000 to $7,000 just sitting there and growing and adding money to it regularly. It's a whole other way to save on the rising cost of healthcare.
Let me just add one thing to the HSA. For those of you that have an HSA, you can also take a distribution from your IRA and put it into an HSA one time without the tax penalties.
Also, remember the 5 Ps. My brother's a retired major, a logistics officer, and one thing I remember him learning in his basic course, the 5 Ps. Prior planning prevents poor performance. And I think that's applicable not only to something like this, but pretty much anything in business. If you know the issues and you do some thought and planning, you'll probably be in good shape.